Hello, sweetie.
Yes, hello.
So I've made you the host now. I've made you the host.
Okay.
I may not be on for the meeting, but for the talk, but I'll join in when I'm done with the interview. Okay.
Okay, no
Bye.
problem.
Bye.
Bye.
There now, you see, you see. Yeah. That's a good place. But they didn't say so. No, I mean, that's understandable. The guys. That's it. Yeah. It's supposed to be like, I think it's like, I'm sure my face in the beginning of the I'll try my face to myself and get ready to. I'll try my face and give myself. It's a nice you feel busy. But the beginning, if you do it the beginning, the habits, let's go. So it has to make the morning. At least not 5 minutes. 3. I think it They say what someone wants I don't understand. If you don't have anything, you don't know. You don't have to take you I'm a general secretary. So that means, yeah, to go to the expression. Yeah. The lady was asking if we did dental surgeons, so that she should excel. I knew she wanted to say, I knew what she was asking, but she tried the right way. I'm not answering what she challenged. So I said what she could explain what she meant by dental surgery. Because of the surgeon parts, I knew she was trying to talk about the cameras, like the specialty, like the visual safety. I just wanted to see it the right way. So I told her that, oh yes, you have special that combination. Yeah. After she explained what she meant. I don't have to see because I'm a dental surgeon. So that people are open. Yeah. I see the most. I think that's yes, yes. I don't know. Yes, yes. And the man that is supporting was the creation of the assignments. So we have so take care of me and I'll call you. You should get
Maybe they will know that if I do the video, it lose my price.
I think about it, that's all. I don't think about it.
Being a master.
It makes a difference.
Me, I don't know.
Good afternoon, everyone.
Good afternoon.
So sorry for again. Good afternoon, everyone, once again.
Yeah, my boss is here.
So please, you're all welcome to today's team talk on oral health, which is very crucial to our well-being. I'll please lead on Portia to say a word of prayer for us to start. Portia. Please, can you mute your mic, please?
Yeah, you should try to send your back 2015. It's a give us sad, yeah. The media, that one, she didn't number us. But you send your what she said you should never. So then you never thought and true. Every moment in about 2015. So we need to listen. If you are not part of them, power, sir, everyone so.
Please let us pray. Our Heavenly Father, we thank you, we bless your holy name. We give you all the glory, we give you all the honor. We thank you for such a wonderful day. Father, we bring before you, oh God, this talk that we are about to go through. Father, we pray that your presence shall be filled. Every discussion that will be here, Father, shall be fruitful. With this, we pray in Jesus' mighty name. Amen. The network is very bad. Okay, so please to give us this talk is Dr. Alote, affectionately called Dr. Phoebe. She is a great dentist with many side and passion for beautiful smile makeovers. A proud alumni of St. Rose Senior High School. She has a degree in dental surgery from the University of Ghana School of Medical and Dentistry. Her area of interest includes oral and maxillofacial surgery and dental public health. Outside of work, Dr. Alote enjoys singing, dancing, and drawing. She believes strongly in giving back and is a member of the Save a Street Child Foundation and has taken part in numerous other medical outreach to support the less privileged. Dr. Alote finds great joy in relieving, solving, and consoling people with dental problems and helping restore health, beautiful smiles. Without much wasting time, let's welcome her to give us the talk. Dr. Alote, hello. Hello, doctor.
Hello.
Yes, doctor. Good afternoon.
Good afternoon.
Yes, please. So please, the floor is yours now.
Okay. Please, you haven't given me permission to share my screen.
Sure. Yes, please. You can now.
All right. Thank you very much.
You're welcome.
Can we all see the screen?
Yes, we can.
So it's a very brief conversation about dentistry and what we do here at Impact Specialized Dental Clinic. The idea was to have done that before the training that we undertook. Yes. So it's going to be very brief, like I said, and then at the end of it, if we have any questions, we can just talk it through. All right. Or the title of the conversation is What's the Mouth Could Say? So first of all, we want to define what dentistry is, so we understand who a dentist is, what dentistry encompasses, and then can move on from there. So dentistry, also known as dental medicine or oral medicine, is a branch of medicine focused on structures of the oral cavity, teeth, gums.
Sorry about that, Doctor. You can continue.
Hello.
Yeah, hello, Doctor. We can hear you.
Okay. So dentistry encompasses other aspects of the craniofacial complex, including the temporomandibular joints, or the joints in your jaw, your joints, and then the facial bones. And then we have a lot of specialties in dentistry. The most common ones we know about are cosmetic dentistry, or people that restore your smiles, orthodontics, orthodontists, who are the braces doctors in human terms, then pediatric dentistry, and then others. Here at Impact Specialized Dental Clinic, we offer a wide variety of these specialties, most commonly including the cosmetic dentistry, oral and maxillofacial surgery, orthodontics, pediatric dentistry, just to name a few. So this is the anatomy of the area that we deal with, because in dentistry, we deal with the head and neck, or the craniofacial complex or region, like I mentioned, and then the mouth, or the oral cavity. So the oral cavity is in different parts. As we can see the lips, which is the external parts of the oral cavity.
Excuse me, Dr. Alote. Please, we can't see your screen.
And then the
Hello, Doctor.
Tongue. We have
Dr. Alote.
Please, we can't see your
at the
screen.
back of your mouth. We have the palate. You can't see
Hello,
my
Dr.
screen.
Alote. Yeah, your screen is off.
Sorry. Please give me a minute. Please, can we see the screen now?
Yes, I can see from here.
So can I continue? Hello.
Hello, Doctor. Okay.
Hello.
It's Hello, doctor.
I'm asking if I can go on.
Yes, please, you can. Your screen is on now.
Okay. So I was talking about the anatomy of the oral cavity and then the craniofacial complex. So here we see the lips, we see the tongue, we see the inside of the mouth, which is what encompasses the oral cavity. Then on the other side, we see the head, which is also a part of, which is the craniofacial complex, like I mentioned, that is also a part of dentistry. Then the next slide, we are seeing the teeth and then the anatomy of the teeth. So we see the enamel, the hardest part of the teeth, and then the dentine, which is underneath the enamel. And also we see, so it's been labeled 1. So 1 is the crown or the parts of the teeth that is in the mouth, and 2 is what's called the roots within the jaw or the jawbone. And 3 is, like I said, the enamel. 4 is the dentine. 5 is called the pulp chamber, which is where the nerves and then the blood vessels that keep your teeth alive are found. Then 6 itself is called the pulp. Then 7 is the gum. Then 8 is the bone. 9 is the bone within which the tooth is found. Okay. This definition of health I'm bringing up because we had a lot of people making or asking questions about the necessity of coming to see a dentist regularly or when you don't have problems. And by WHO's definition in 2006, health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So just because you do not have an active disease going on, you do not have symptoms or signs, or there's nothing, you think there's nothing wrong with you, doesn't mean you shouldn't get yourself checked, or doesn't mean that you are particularly healthy. And for example, especially in dentistry, there could be a lot of underlying issues going on or disease going on, but they do not manifest with the most common signs or symptoms of disease that alerts people and make them want to go and see a doctor, which is typically pain. Most of the time, they do not manifest until it's too late, and then when you come, there's not much that we can do about it. That's why we're advocating a lot of times that you should get yourself checked at the dental clinic or by dentists at least twice a year, so that even though you feel like there's nothing wrong with you, if there's something that is actively going on that hasn't reached a point where it's going to give you problems, you can pick up on those things and immediately deal with them. All right. So then the next slide is talking about the most common, disease that we see in dentistry, which is dental caries. So it's an infectious disease which results in cavitation of the tooth, resulting from the presence of a viable tooth, a substrate, which is carbohydrates or sugar, bacteria, and then time, all in the presence of saliva. Once one of these things is taken away, dental caries or the infectious disease, which is dental caries, cannot continue or cannot occur. So the pathogenesis is just the explanation that once you have all of these things, the viable tooth, the substrates, the bacteria and time, all in the presence of saliva, then it's able to occur. Symptoms of dental caries include the most common one, which is pain. There could be cavitation or a hole in your tooth. Sometimes it could even manifest as mouth odor without the pain. And it might manifest as mouth odor. Then you can't complain that you have a strange smell in your mouth, especially when you eat, because then the food goes to pack in these holes and then they later decay and then they cause a mouth odor. Then it can get so bad that you can end up coming to the clinic with a swelling and even a fever. That's the extent that it can even get to. So here we are seeing on the right, we can see the tooth with a cavitation in it. This is the beginning of the dental caries. Most likely the patients might have mild pain or even sensitivity, especially when you eat or when you drink cold fluids, but then it tends to go away. So then you forget about it. It only comes on when you eat and it doesn't really last for a long time. So then you figure it's just one of those things and then you brush it off and then you move on from there. If this is something that you're experiencing, my advice is that you go and get it checked just so that we can rule out dental caries. Treatment options for dental caries is dependent on when you present and what is happening at the time of presentation. So this is somebody who has presented very late with something called rampant caries, which essentially means that they have caries affecting almost all their teeth. Yes, there's not only caries in the picture. You can actually see there's this whitish coat or film around the teeth, which is called dental plaque, which also can lead to dental caries. So treatment options, like I said, will depend on how far along the disease has gone, and then the time of presentation, what the patient is willing to do about it, how committed they are. So it includes a filling, a regular dental filling, remove the decayed part of the tooth and we fill it up with the material. A root canal, which is treatment of the tooth to devitalize it or to remove the pulp, and that will prevent pain from occurring, and then keeping the tooth in the mouth. Or a dental extraction at this point, at the point where there's not much you can do to save the tooth and keep it in your mouth. All right. Then the next most common presentation at the dental clinic is halitosis or bad breath or mouth odor. We have people asking about it as well. So the causes range from not keeping your mouth clean to even having a systemic condition. So certain types of foods that you eat, especially spicy foods, garlic, onion, they contain what we call volatile sulfur compounds. That's when they react to the bacteria in your mouth, the normal bacteria in your mouth will release a gas that is not pleasant smelling. So then we advise that whenever you eat spicy foods, immediately you rinse your mouth with water, or you get sugar-free gum or mint, sugarless mint, one of those, just to help refresh, give your mouth a fresh, some freshness. Or if you can, if it is possible, you can brush your teeth, just remove the stench from your mouth. Another thing that causes bad breath or mouth odor is poor oral hygiene. You're not brushing as many times as you are supposed to do, which is twice a day. You're not brushing properly. You're not using the right toothbrush. And then especially when you do not see your dentist regularly, because there are at a certain point, no matter how well you're brushing or no matter how hard you're brushing, the toothbrush will be able to get rid of all of the dirt around your teeth. And then there will be a buildup of the plaque, which cause mouth odor as well. Like I mentioned, there are some systemic conditions too that can give mouth odor. For example, diabetes, people who have gastric reflux disease, all of those things can give you a strange smell in your mouth. All of these are only picked up when you go and see the dentist. We're able to eliminate causes and then direct you to the appropriate specialists or refer you to the appropriate doctors for it to be taken care of. I already mentioned the pathogenesis, which is when the bacteria reacts with the volatile compounds and produce the foul-smelling gas, or when the systemic conditions you have, for example, in the gastric, the reflux disease, it brings back food from inside of your stomach back into your mouth. That food has undergone some change, so then it will not smell as good as it was before it went in. Prevention of halitosis or mouth odor starts with you first identifying that there's mouth odor and then immediately going to see the appropriate specialist and having it dealt with. So if you come and see, for example, me, who is a general dentist, I'll help you eliminate the causes, or I'll help you identify what cause it is. Then from there we can move on. If it is the kinds of food you're eating, then you have to make sure that you are enforcing the proper oral hygiene after you've eaten those foods. If it's poor oral hygiene, then we teach you how to brush properly so that you maintain a good oral hygiene. If it is a systemic disease, some people do not even know that they have these diseases, then we can refer you to an appropriate doctor and then it will be dealt with. Yes. And treatment also can only be undertaken after it has been identified and been referred to the proper places. But the treatments will be mostly the improvements of oral hygiene and then referring to the appropriate doctor if there's an underlying systemic cause for it to be taken care of. The biggest complication of halitosis is actually not a physical one, but more of a mental one. It's sort of, it can really wear on your mental health, can cause anxiety and even depression, even to the point of to the point of death. People have contemplated suicide because they felt alienated or they felt ostracized because they have bad breath. Even some people do not even have bad breath, or they've had bad breath before, it's been taken care of, but that stigmatization or that alienation can never go away. So then we have to be very, very careful how we even address people that do have bad breath, so that we do not end up causing more harm than good. Okay. So the next one is gingival and periodontal disease, or gum disease in layman English. So the periodontium essentially is what I mentioned before, the bone around your teeth and the gums where your teeth are found. So periodontal disease is inflammation of the supporting tissues of the teeth, which is the periodontium. And then gingival disease is inflammation of the gum itself. It's usually secondary to plaque or systemic diseases like diabetes and even hypertension. The symptoms are usually bleeding, especially on brushing, or sometimes bleeding that starts on its own without you doing anything. Some people wake up in the morning and then there's blood in their mouth. It's a very, very pointed sign that you have some form of periodontal or gingival disease going on. Then it could also be pain, ulceration of the gingivae, and then there could be swellings as well. So as soon as you pick up any of these signs, it's best to go and see a dentist and let them find the source of it and then immediately deal with it. The treatment varies from a simple scaling and polishing, a regular scaling and polishing, to even surgical options where we'll have to remove some teeth and move or reorganize your gum around so that everything else is fine. Can even include talking to your general physician about your systemic condition, for example, in the diabetics and the hypertensives, so that we work together and find a way to care the periodontal disease. But then afterwards, no matter what the cause of the periodontal disease is, optimal oral hygiene is the only way to keep it in check or to prevent it from getting worse or happening again. This is a picture of teeth. You can see the swelling around the teeth. The gum looks swollen, a little red. You can also see these dark stains on the teeth, which is plaque that is building up. Eventually, it's become too hard for your toothbrush to get rid of. And then this is what causes the periodontal disease or the gingival disease. This is another picture showing plaque between the teeth, especially when there's not a lot of space. And then in this case, the person has actually lost some of their teeth as a result of periodontal disease. Then we have tumors. Tumor in general English is a swelling. So we sometimes have swellings that occur in, like I mentioned, the craniofacial complex, so the head and neck region, or even within the mouth itself, from the lips to the tongue, to the gums, to all the way inside towards the back of the throat. If there's a swelling on your face or within your mouth, it's usually taken care of by a dentist or a maxillofacial surgeon. So tumors are, like I said, essentially a swelling. So when there's increased proliferation of regular cells in your body, we know that the organs or the structures in your body are made up of cells. The cell is the basic unit of life. So when there's increased proliferation of the cell, then it becomes a tumor. So another thing I have to remember is tumors are swelling. So whenever there's a swelling, it can be referred to as a tumor. However, not all tumors are cancers. Some of the tumors or some of the swellings, after they have been investigated further, will be found out to be cancers. But once you have a swelling, it doesn't necessarily mean that you have a cancer. So all cancers are tumors because they are swellings, but not all tumors are cancers. It's very important for us to take note of that. It's important for us to understand that oral cancer, even though it is not very popular, is one of the leading causes of, well, one of the leading or most popular cancers in the world. It's about the 6th in the world at the moment. And sadly, because it's not very popular, it has a very high mortality rate, because usually by the time people eventually present to the hospital for care, it's so bad that there's diminished quality of life after we have managed to get rid of the cancer, or there's direct mortality or death. So it's very important for us to take note of these things. All of these things can, like I'm saying again, be picked up when you have regular visits to your dentist. So it's very, very imperative, very important that this becomes a part of you. Okay. Some of the common cancers are of the mouth include squamous cell carcinoma. It can affect anyone in the mouth, from the lips to the tongue to even the jaw itself. Yes. So risk factors of cancers include a lot of things. For example, your social life, smoking, drinking are very, very high risk factors for cancers. So we have to be very mindful of those things as we indulge in them. There's a genetic factor that also plays a big role in getting a cancer. There's so many other things, but the main things that we can control is our lifestyle. So the smoking and then the drinking. Prevention of cancer is largely making sure that you are checked regularly, so that once it starts, it's able to be picked up immediately and dealt with before it gets to a point where there's not much you can do. Okay. And then the treatment depends on what type of cancer it is, how far along it is, and even where it is. It could range from just chemotherapy, which is taking drugs to shrink the cancer, radiotherapy, which is the use of X-rays, or even surgery. In the picture here, we see the tongue. There's a swelling on the side of the tongue, which is very likely a cancer. It could have been caused by, as you can see, that these dark things on the teeth, fillings, or amalgam fillings. Sometimes if you have fillings that have been in your mouth for a long time, with wear and with time, they become a bit rough. As your tongue keeps scraping it, you keep scratching your tongue, it will cause an ulcer or a sore that will never heal, because the stimulus is still there. Because every time it scratches, your tongue can't move away, the filling's not going to go anywhere. So it keeps scratching it. So even if you've had dental treatment before, it shouldn't be that because you've had a filling and now you don't have a problem, you shouldn't get it checked out. Regular checking would have probably gotten stop this from getting this far, because the dentist would have been able to pick up the fact that the fillings were rough or they needed to be changed so that the persistent or ulceration wouldn't have occurred. Then at the top, you can see cancer of the palate, which is the roof of the mouth, or the top, the upper jaw. The second slide is not a cancer, it's a tumor. Like I was saying, not all tumors are cancers, but once there's a swelling, we can refer to it as a tumor. So this is a tumor that was removed surgically, and now the picture on the other side is the patient after the tumor has been removed, and she looks very fine. I mentioned that there are some diseases that we can pick up that kind of affects the oral cavity. There are even times where you can pick up these diseases in the mouth before the patients even know that they have them. So some of these diseases include, like I was saying, diabetes, leukemia, gastrointestinal diseases, dermatological diseases, autoimmune diseases, and even HIV, and then some syndromes. They can be picked up in the mouth. So next slide we see the swelling of the gums around the patient's teeth. This could be as a result of leukemia, even diabetes, or even hypertension. The second one, we see there's swelling at the corner of the patient's lips. Sometimes it's a sign of HIV, it could be a sign of herpes, or it could just be a sign of regular anemia. Once all of these things are happening, it's best that you present to the hospital and then you are referred to the appropriate doctors for it to be sorted out. Then the last picture here, you can see the patient's teeth. This is usually seen in patients who have gastroesophageal reflux disease or acid reflux disease, because they keep bringing up food from their stomach. It causes wear of their teeth. They usually present with severe sensitivity and wear of the teeth. And it's usually only when they start to have the severe sensitivity that is unbearable that they eventually present to the clinic. So we should always take note of these. Okay. Some other things that you see in dentistry include clefts, which can affect the lips or the upper jaw, syndromes or the aberration of the norms, and then trauma. When you're involved in an accident and there's fracture of your facial bones, or your face is involved in an accident, is a maxillofacial surgeon who is actually a dentist that is brought on to come and deal with it. Okay. So these are pictures of what I just mentioned. You can see at the top, there's a cleft of the lips and then the palate. Then this is a syndrome. Probably, I think this is ectodermal dysplasia, where there's aberration of the normal formation of the teeth and sometimes even of the patient's skeleton. Then you can see an X-ray of a head or a skull, which has been involved in trauma or an accident where there's fracture of the facial bones. Okay. So this slide is showing a filling that was done for a patient after she presented with fracture of her tooth. She presented early enough so then we could do a regular filling and then she was fine. This is patients who had orthodontic treatments before and after pictures. Yes. So now, safeguarding, or what we should be at the end of this long conversation, the most important thing that we should pick up is that we are supposed to be brushing properly and in terms of technique and then number. You're supposed to brush your teeth twice a day with a medium bristle toothbrush and a fluoride containing toothpaste. And then we advise not to brush in upward strokes, but rather in a circular motion to prevent wear of the teeth and not too harshly. I keep encountering patients who say if they do not hear the sound of the brush on their teeth, they don't feel like they brush their teeth. So until they hear that scrubbing sound, they are not comfortable. But that's not the goal. The goal is that without necessarily having to hear that scrubbing sound, so you don't use a hard toothbrush, you're able to clean your teeth in circles and remove as much of the plaque as possible. And then visit your dentist regularly so that they remove the rest where your brush cannot reach. Another thing a lot of us do not do is dental flossing. It's very, very important because your brush should not be able to get into all those tiny spaces. So the thread-like instruments or the dental floss is able to get into those spaces and then remove all of the food that is there. Then a third habit that we should all adopt is to rinse our mouth after every meal. Once you've had anything other than water, you can get a sip of water and just swish and swallow. Like I keep saying, you swish and you swallow. If you do not have, if you don't have access to a sink, that's fine. If you have access to a sink, you're able to brush, perfect. If not, you swish, you swallow. Okay. Then our diet. A lot of us like to eat a lot of sticky foods and carbohydrate foods or carbohydrate-rich foods. It's not necessarily eating raw sugar that will give you caries. But if you eat a lot of sticky foods, plantain chips, kelewele, cheesy meals, all of these things can get stuck in the crevices of your teeth. And if you're not able to get rid of them, can eventually cause dental caries or even buildup of plaque and cause mouth odor. Then snacking, especially in between meals, is something that we have to be checking. Even if you intend on snacking, maybe we should look at healthier options like fruits. Carrots is one of the very healthy options that will also allow flow of saliva in your mouth. It will prevent your mouth from drying up, which can lead to bad breath, and then it will also keep you full and prevent dental caries. Then we can also adopt the habit of using straws, especially when we are taking high sugar content foods like drinks and sodas. And hand washing is very, very important because it's for general overall well-being. And then we should learn to keep our hands off our faces because it can cause infections, especially when your hands are not clean. And then, like I keep saying, the regular checkup at least twice a year so that everything that can be sorted out before it becomes a problem is picked up and then dealt with appropriately. So this is why, and thank you very much for your time. Please, I hope you all heard me.
Yes, Dr. Alite did. Okay, thank you very much for this insightful presentation. Wow, we've learned so much. Okay, so please, is there any questions for Dr. Alite to answer for us? Even the one had any questions to ask.
Hi, Christy. I have a question.
Okay, please, Dr.
You
Alite
made
is
mention
listening.
of caries. Mine is about a hole in the tooth. Is it
Okay.
compulsory that every hole in the tooth should be, or every cavity in the
Yeah.
tooth should be removed, or remove every cavity that has affected a tooth?
Okay, thank you very much, Christy.
Please, it's
This
Vida here.
Vida, this Vida.
Vida, sorry.
Yes,
Thank you very
please.
much, Vida. So your teeth shouldn't have cavities in them. Cavities are allows there to be food packing. So then when you eat something, gets in there, you're unable to bring it out by brushing or by raising your mouth. Then it stays in there. Bacteria in your mouth work on that, whatever it is in there, break it down, which will eventually make the cavity bigger and deeper and cause much harm than good. So once there are cavities in your teeth, not spaces, that's one of the things a lot of us tend to confuse. So there's a difference between spaces in your teeth and then cavities in your teeth. Once there are cavities in your teeth, these should be immediately dealt with before they get too far. Please, I hope that answers your question, or if you want any more clarification.
Vida, are you okay?
Yes, I am.
Is your question answered? Okay.
Yes.
Thank you, doctor. Please, any more questions for doctor?
Sweetie, I want to ask a second question.
Yes, please go ahead.
Dr. Alite, with I think Forever Fashionable. Please, could you mute your microphone for us? Thank you. With composite filling, how different is it from the normal filling, or is it the same thing? And how frequent should you get it filled?
But please, could you help me understand what a normal filling is, so that I know what we are comparing?
Okay. I don't know the difference though, but I hear, somebody has gone to fill the teeth. I think you made mention of it with a broken tooth, and then after it was filled. So I want to know, is it the same as the composite filling? And if somebody has, let's say, a cavity and wants to get filled, how long should it take for the person to go and refill again? Or is it something that is done and dusted, that is once and for all?
Okay, thank you very much. So a composite is a type of dental material that we use for filling. It's one of the newest on the market, and it's much more aesthetic, as in it looks closer to your natural. So a lot of people are more likely to accepting of that. As for fillings, depending on where the filling is and especially how big the cavity was before the filling was done, they can last for a long time. But just like with your teeth, with function, it can wear off. The fillings can also eventually wear down, or they'll be reducing. That's why the regular checkup helps. So if you are seeing your doctor, even if it is once a year, and every year you go, he examines and your fillings are reducing in size, by a certain point, it would have gotten to a stage where then you need the new filling to be put in. So then he will advise you accordingly, and then you move from there. So I can't say that it's going to last for, say, 5 years. So then you decide to wait until it's 5 years before you see your doctor and have it changed. It's better that you're seeing your doctor regularly. And then as and when he thinks that it should be changed, he'll discuss with you and then you move on. But the fillings are made to last for a very long time. Yes, please.
All right, thank you.
Okay, thank you, doctor. Please, any more questions for Dr. Alite to answer?
Yes, Sweetie, let me ask again, or maybe today
Yes,
I
please
have all
do.
the dental
Yeah, enjoying the
questions.
questions and answers.
These days,
Okay,
they are
Paul
not
here.
more
I
on.
want to ask Doc, sometimes when you fall sick, then yes, it's still on it. I mean, when you just sometimes you get sore on your tongue or your lips or the gum. That's what I wanted to know, whether it's still a disease that is in the mouth that you ought to check.
Okay, thank you, Paul. So like you mentioned, it sometimes comes when you fall sick. when that happens, it means you're probably going to see your general physician and they'll prescribe or they'll treat you appropriately. If you notice, however, that after your sickness, or even you feel like whatever the sore is in your mouth is getting worse, you can make mention of it to your GP. You take a look and refer you appropriately. Or if you feel like after the disease that you think brought on all of these symptoms has been treated or has been dealt with and it's still persistent, then you definitely have to immediately go and see a dentist and then have that sorted out. I don't know if that answers your question, please.
Yes, please, it does. Thank you.
You're welcome.
Okay, Vaida, please, you're waiting for the next questions from you.
Okay. I was asking about the dangers of teeth whitening. These days, there are a lot of teeth whitening adverts and people going for it. You see a lot of people partaking in it. So what are the dangers of whitening?
Hello, you can hear me?
Yes, please.
Okay, so teeth whitening is a cosmetic procedure that is supposed to help lighten the natural shade of your teeth and give you a little or a much brighter smile. When done in the right way, it shouldn't have any complications at all. You might have maybe a little sensitivity just after the procedure, but then that should eventually go away. Before we actually do teeth whitening, we check and make sure that you do not have any underlying periodontal or gum disease. You don't have any cavities. You don't have any exposed surfaces of your teeth that could make sensitivity worse. Once all of that has been taken off, then we go ahead and proceed with the teeth whitening. That's why we advise that you do it at the dental clinic and not at, because they've been advertising that a lot. There are some spas that even offer teeth whitening services. That is not advisable. It's best to see a dentist. Make sure that whatever underlying condition is going on or you have is taken care of completely before you attempt to have a teeth whitening now. Because essentially what we do is we apply a concentration of acid to your teeth, sort of bleach the surface of your teeth. So if you have exposed parts of your teeth, if you have cavities, if you have gum disease already, and when you do this, you're only going to make the problem worse. Please, I hope that answers your question. Or if you want any clarification.
Yes, I am okay.
Okay.
Doc, I think we have a question here from Ajia Hinkai. She says, how much does it cost to get checked?
To get checked?
Yes, please.
It will depend on what facility you present to. Right now, we have a lot of private clinics in addition to the government hospitals that accepts private insurance and even that accept the national health insurance. So it will depend on whatever facility that you'll be attending. That will determine the rates for the checkup. But it shouldn't be more than, I think, 200 cedis to have the checkup done and then give you advice on what you should do next. And from there, you can move on. I think so. Thank you.
Thank you very much, Doctor. Please, any more questions?
So, Doc, let's say, hello.
Yes,
so
please
Doc,
go on.
You've taken 1 or 2 teeth from your mouth and you want it to be filled up. Do we have the permanent one, and then we also have the one you can take out? And then the permanent one, do we have side effects to it? Because I learned when you do the artificial one, you can take it out without anyone noticing it.
Oh, if you do which one?
Pardon?
Hello, please, can you come again with your question?
So I'm saying, let's say you've taken 1 or 2 teeth from your mouth.
Yes, please.
Both from the upper jaw and then the lower jaw. And then you are coming for a teeth so that everything will align.
Okay.
And I'm asking, do we have the one that it can last? That's the permanent one. And then we also have the artificial one that you can take it out.
Okay. Yes,
also,
please.
and the second question is,
okay,
when you do the permanent one, do we have side effects?
All right. Yes, please. Okay, thank you. So you mentioned correctly that we have 2 main groups of dental or artificial teeth replacements. We call one of them permanent because it is not easily removed, but the actual or the proper term is that it's fixed as opposed to removable. Because the other ones are removable, some people tend to use them for a short while and then eventually decide to use the fixed one. That's why it seems to be temporary, but you can actually use them also for life. So then they can also be classified as permanent. So the terms are removable and fixed. So the removable ones are the ones you can take out of your mouth by yourself. That is the patient. And the fixed ones are the ones you, the patient, can't take out of your mouth. When you come to the clinic, we fix them or we bond them to your teeth, and then it stays there until we come and take them out, or other things that can cause them to come off. Like, for example, if it should break. There shouldn't be side effects or any complications after you've had fixed treatment, unless you do not take proper care of them. Just like your natural teeth, you're supposed to take proper care of the artificial teeth that we put in your mouth, whether it's fixed or removable. If you do not take proper care of them, if you're not brushing properly, if you are snacking all the time, if you're not seeing your dentist regularly, with time, even the fixed one can, the fixed replacements can also actually lose the prosthesis itself and the teeth that have been attached to. Because with the fixed one, the types include one where you attach the missing tooth to teeth already in your mouth, which will act as some form of support or foundation. So if you're not keeping your teeth clean, those 2 teeth or those 3 teeth that are acting as a support or foundation can eventually become diseased, and then you lose them. So no matter whether it's a natural tooth or an artificial replacement, you're supposed to make sure that you have optimum oral health, or you're keeping optimum oral hygiene. Otherwise, you might end up losing, just like your natural tooth, the artificial one. Please, I don't know if that answers your question, or if you want to.
Yeah. So another question, Doc.
Yes.
For the artificial teeth replacement, when you take it out, are you to use fluoride toothpaste, or you have to use ordinary soap and then sponge to clean it?
To clean the removable one?
Yes.
Oh, so the cleaning is just to make sure that it is fresh and clean for you to put back in your mouth. So whatever medium you want to use is fine. We usually don't advise that you use the toothpaste too much because it contains abrasives, which will eventually cause the removable one to become rough. And then once it becomes rough, it's more likely to get dirty from when you eat. And then that's why we advise for instance, advise my patients to use mouth-centered soap to clean it, and a soft rag, so you do not scratch the surface of the prosthesis. So that's basically why we advise that.
Okay.
I know people who, after they have cleaned with the mouth-centered soaps, they put in their regular, what they call those things, mouthwashes, just so that it smells and feels fresh, and then they put it back in their mouth. Thank you.
Okay, thank you very much, Dr. Alote. Please, do we have more questions for Dr. Alote? I think she's very much ready to answer all our questions. More questions for her?
Yeah, I do.
Okay, please go ahead.
Yes. So, I learned if you taking, let's say, both the upper jaw and then the lower jaw, the left and right side, let's say you're taking 2 teeth from your mouth.
Okay.
I learned you are supposed to refill it in order not for your jaw to fall. I don't know what they meant by that.
Okay.
Or everything should align as time goes on.
All right. Thank you, Portia. So your teeth are sort of just your teeth are in your bone, and once there's teeth in the bone continues to live, or it stays there, and that's what keeps your face or gives your face a profile. So you notice that as you grow older, or if you say you compare a younger person to an elderly person, the elderly person's face seems to have fallen. I'm sure that's what you're trying to say. Their face seems to be sagging, as opposed to the younger person's face seems to be more lifted up. It's because of the jaw bones. So once you don't have teeth in your jaws, eventually the bone starts to sort of, we say atrophy, or it's because it's not functioning, it sort of starts to wear down on its own. It's also a natural aging process, but it's made faster when you do not have teeth in your jaw. So the reason why we insist, especially when you are very young, when you lose a tooth, to replace it is because of that one, and also because we don't want it to lead to losing your other teeth eventually. Because when you put your teeth together, all your teeth are supposed to meet each other, or they should always have a counterpart on the other side, so that they keep them stable. So if you lose a tooth in the upper jaw, the opposing tooth in the lower jaw will not have anybody to make contact with. And so with time, that particular tooth will start to become loose, and then you eventually lose that as well. That is why we advise that you get your teeth filled when you have them taken out. Thank you.
Thank you, Doc.
Thank you. No questions for Dr. Okay, so I guess we are okay now. And Dr. Alote, I want to say a very big thank you to you for such a presentation. You've really enlightened us on dental, like oral dental health. We may know some, but we didn't know how deep this is than today. Thank you very much for your presentation. We really appreciate it.
Thank you for having me.
Yeah, thank you. And I'll take this opportunity to say a very big thank you to each and everyone who joined the talk. We are so grateful. Do enjoy the rest of your day. Thank you.